The Anxiety and Depression Network, which is part of the Oxford Academic Health Science Network, aims to improve performance in the local IAPT services. IAPT stands for Improving Access to Psychological Therapies. The network has three main aims. The first is to improve the overall recovery rates for people having psychological therapy in the services, and also to reduce variability in recovery, both between services and also between different patient groups, people with different clinical conditions, older people, younger people, that sort of thing. The second aim of the network is to take local examples of innovation where one particular area has been developing a project which aims to extend the psychological therapy program to a group of patients who currently don't benefit from it. Many of these projects focus on people who are suffering from anxiety or depression in the context of a long-term physical health condition, such as cardiovascular disease, diabetes, obstructive pulmonary disease, and in all of those cases, what tends to happen at the moment is that with these long-term conditions, you often get quite detailed help with the physical condition. You're strongly embedded within our physical healthcare system, but almost because of that, you get rather less access to the mental health services. It seems like the NHS is organised in silos, and this really doesn't make sense, because we know that if you have a long-term condition and you also have anxiety or depression, it costs the NHS a lot more to treat your long-term condition. Furthermore, if we give you a psychological treatment for your anxiety and depression, then not only does that reduce your anxiety and depression, but the cost of delivering that treatment is more than covered by the savings in physical healthcare for your long-term condition. So it's sort of economic madness not to join up the two bits of the system. The third project in the network focuses on children and young people who have anxiety or depression. And so the reality for most children and young people with a chronic anxiety or depression problem in England at the moment is you have to grow up before you can get an evidence-based psychological therapy. We hope, of course, that's going to change. We hope that soon the government will invest more in the children's services, because untreated anxiety and depression blights a child's life in a way which is difficult for it to recover from. You often get much less good exam results than you'd expect. Your social development is impaired, and these are things which will undermine the quality of your life for the rest of your life. So it's important to get in early. What we're doing in the Academic Health Sciences Network is to make ourselves ready for that expansion by ensuring that our local children and young people's IAP services are operating very efficiently and are in the best possible place for an expansion. And one of the key things we want to achieve is the very high level of data completeness in terms of outcome monitoring for children and young people that we've already achieved with adults. So in adults, about 97% of people who are treated for their anxiety and depression psychologically have their outcomes monitored. So we really know what's happening. In children and young people, it's a much lower figure, it's about 60%, and we want to change that. We want to improve that by at least 10%, hopefully more. Once we've done that, of course, we can then study what are the variations in outcomes that we get with our children and young people, and then drive the system forward in the same way that we are with adults to improve the overall recovery levels for children and young people.